So today we're going to talk about acupuncture and East Asian medicine during pregnancy. This is something I am very passionate about, and I will tell you why. I know it's going to sound unbelievable, but when you are affecting a woman who is pregnant, you are not only affecting that woman, but you are also affecting that child and that child's child. Let me say that again. When you are treating a pregnant woman, you are treating not only that generation, not only the next generation, but the future generations from the mother, the child, and the child's child, because the baby will be born with all of its eggs it's going to have. That is why it's so important to not only affect what we eat, what we put in our bodies, what we put on our bodies, and how we live our lives. In East Asian medicine, they call it jing or essence that we take on from not only the mother, but the father as well. But a lot regarding the development of the fetus relates to the mother. But even from the sperm and the quality of that sperm from the male and the quality of the egg from the female coming together will affect that child, as we know. But then through treatment of pregnancy, we will also be affecting that child's child, because the healthier that baby and that fetus develops, then that will affect the next generation. And this is an important awareness because we have done major changes in our environment and in our food and in our lifestyles. And how has that affected our health and our children's health? So the only thing that I know is to share this information, and that's why I'm so passionate about it. And acupuncture, East Asian medicine, herbs, awareness of diet, and all of these different ways of looking at things make a difference. So I understand that many people don't realize, number one, the knowledge around treatment for acupuncture during pregnancy is lacking, which is why I'm here. So primarily, number one, to inform you of all the benefits of acupuncture and East Asian medicine that can help during pregnancy. And number two, take out the fear that is circling around this medicine and fear of miscarriage, and it's quite the opposite. So let's jump into it. We'll dive into it. This is Dr. Lone, but I don't like needles. So right off the bat, I want to acknowledge that every woman is going to have a journey and every couple is going to have their journey. However, it is extremely important to recognize that it takes a village. It takes a team. The idea that we can do everything on our own, I really do believe gets in our way. And when you are trying to get pregnant, that is one journey for you. And for some, it's more difficult than others. And you start to develop a team. And I'm talking about East Asian medicine providers, acupuncturists, midwives, OBs, therapists, all sorts of people that are going to support you in that journey. It gets even more so when you are pregnant and now you are growing a child. And then you need even more of a community and a group support when you are postpartum. And then it's even a bigger community when it comes to raising a child and building a family. It doesn't load only on the parents' shoulders. So I highly support and suggest that you build your team. As you know, just in regular everyday healthcare, I've preached this in previous podcasts, how important it is to have a team, chiropractic, naturopaths, your primary care provider, if it's a medical doctor, East Asian acupuncture, medicine, whatever therapy, social work that you need to keep you well and balanced in every way is only going to make your life better and everyone else's life around you better. And when you bring a child into this world, you'll make their life better as well. So understanding that, because we all have different perspectives and we all have different pieces of information to share. So going forward with that, I want to start with the first trimester. I highly recommend that before you even consider getting pregnant, if this is something that you are planning, that you come 3 to 6 months and start getting treated before you actually want to try actively. And the reason why is because again, as I was saying, the more balanced and more healthy that mom and dad are, and I highly recommend both, are well and healthy regarding their diet. This is emotionally, this is physically, this is making sure that you have all the nutrients that you need. You are setting yourself up for a healthy, smooth pregnancy. We call this preparing the palace in a way. I have one mentor that used to call that prepare the palace, i.e. the uterus, because the uterus needs lots of support and nutrients, etc. So that's the first thing. Then once you are pregnant, I know that people fear that first trimester, and there's been history of people trying to avoid it in fear of miscarriage. Let me clarify. There are definitely points that contract the uterus. There are definitely points that descend the pelvic floor. So anyone that you're going to in regards to pregnancy or fertility, as I've said before, I would highly recommend you go to someone who specializes in this. However, with that being said, oftentimes those points, even when I'm using those for induction, they need electric stimulation. I'm leaving them on for 30, 40 minutes. I'm deeply activating those points. They're not a point where you would barely needle it and then all of a sudden you go into labor. It's not like that. So just to understand that first trimester, what's so important, I will say, is number one, that fight or flight. If you are pregnant and let's just say you have a history, unfortunately, of some sort of miscarriage or difficulty getting pregnant, fear creeps in. And the best thing you can do is to reduce that, get us out of fight or flight, feed or breed. So again, once that positive pregnancy test is there, what we need is a relaxed state, parasympathetic, and you need blood flow to the uterus. Because if you are in fight or flight, I've unfortunately seen this, people who will say, it's fine, I'm going to continue with my lifestyle, and it's an extremely stressful lifestyle. They go and they leave town, and now they're in this stressful state. What happens here is that your blood flow does not go to the uterus when you're in that state. Now you're not going to have a thriving fetus if you don't have that nourishment and blood flow to the uterus. So it is so important to find yourself in a 1 to 2 times a week of relaxing and getting out of that fight or flight and increasing the blood flow to the uterus. With that knowledge, there are points specifically locally and distally, which means on limbs or further away from the uterus, that actually do bring blood flow to the uterus. So those are important as well. The other thing that I want to talk about when it comes to that early onset is making sure that we are staying in alignment, that we are getting the nutrition that we need. So in different parts of our pregnancy, your fetus is going to need different support. It will take that from mama. So if you're not getting it, neither one of you are going to get that. So you want to make sure you are aware of the different stages of the different development of the fetus in order to get the nutrients that you need. And some are misled in this way a lot of times as to what you need during those first trimester. You don't need to increase any more food, but you do need to look at what you're eating. Those are the primary focuses. First trimester, also, of course, we all are aware of the morning sickness. And there are proven studies, which I will attach, regarding PC6, which is a very classic point that you can use with needles, you can use with tacks, you can use with magnets even, and has been proven to reduce morning sickness. Another option I always recommend is our posture. So our spine is very important. And this is why chiropractic is often used in pregnancy as well. If we can keep space and keep ourselves in alignment in the spine, then there will be better nerve conduction to the organ systems. And if our stomach and our digestion is impinged, your absorption will not be as successful, and that will cause problems. Also, I find nausea to be highly associated with a toxicity that our liver doesn't want during pregnancy. This can be hormone deregulating things that we have in our body, on our body, and this could be in our foods, etc., which is why they recommend that you don't do cold cuts and turkey meat and sandwiches like sandwich meat. Got news for you. If you aren't supposed to have it in pregnancy because it's neurotoxic, I'm telling you, you shouldn't have it, right? So that's the deli meat situation, but then also preservatives for our foods. Sushi, they always are worried about the mercury in the tuna, right? This is bad for baby fetus growing. It's bad for us as well. So just be mindful of all of that. And we will be able to treat that and help you through that. I also want to make a note here that I do find that a lot of these symptoms don't exist if you are in alignment. So I have had many of my patients, most of my patients, especially those who have gone through a natural infertility journey, and they can't believe that they're not having any symptoms. They don't even feel pregnant, because when you're in alignment, you don't have as many of these symptoms and severe symptoms. Side note, when you are going through IVF and IUI and you are having exogenous hormones, we're trying to metabolize those and balance those, it's a little bit more tricky. So I do find that there can be an increase in those symptoms for people that are undergoing ART. However, we do still help with that tremendously. And then we get into our second trimester. So our second trimester, baby is starting to grow and the relaxin is starting to kick in. It is very important that we are aware of laxity, and we want to stay in alignment as much as we can, because it's in this time that as baby grows and we have this hypermobility in our joints, that things can get out of alignment. And if they get out of alignment now you're going to have more trouble in your third trimester. And I hate to say it, oftentimes they continue even after pregnancy if you are not getting this treated. And those sort of injuries or misalignments or pain that comes during, like sciatica or etc., or some sort of impingement, these things will haunt us later if we don't get them treated while the relaxin is there, because then once the relaxin is no longer there and we are now starting to tighten, it only makes it more difficult and nearly impossible, because you'll hear from people like, well, I've never been the same since pregnancy. And this is what we want to avoid. There are studies on lower back pain and pelvic pain and pubic symphysis pain that's treated for acupuncture in pregnancy, and they compare it to a sham acupuncture, which is kind of like a faux pretend sort of acupuncture, if you will. They do it in many different ways, or a control group that gets nothing, and they will see a reduction of 30 to 40% of pain within a few days, and then no pain after 2 weeks. And then there was other ones with auricular that I've seen that have shown that there's actual differences even postpartum from those who got acupuncture who did not. And we'll attach those studies as well. So it's so important to continue through that journey. Our alignment is so important. Remember that I find that when you are sitting a lot for work, baby doesn't have room, baby will go into positions like an occipital posterior position. We would consider that sunny side up, or a breech position. So the goal of keeping space in the alignment between the vertebra you can do this with acupuncture, again, you can do this with chiropractor as well, is to get some space through there. And there are points which will lead us to our third trimester and moxa and things that are going to help with flipping the breech baby. And a lot of people maybe aren't aware of this, but it's extremely important. In addition to, you'll see a lot of spinning babies, which is a website, and recognizing doing things that are giving some traction and some space in the spine. We do so much sitting now. We do sitting when we drive and sitting when we are working. And that is putting a compression in the spine that does not allow room for baby to be in the position that would be best, which would be head down. So if we can give space there and then do these points and moxa that we've been known to work, there's been great success. I've had great success with having the baby flip. And you can see that on my Instagram of me doing moxa on a point, and it took the one treatment. This doesn't happen with everybody on the first treatment, but it is pretty successful in my experience. So that would be the third trimester. Is now we're talking about positioning of baby, late second, third. And then third trimester as well, of course, we are going to talk about preparing for labor. And labor, we want to keep all of those hips open, especially for a first-time mama. We want to, and if they've been athletic, if they need to open all of the hips around the pelvic girdle to allow for baby to come out and for that pelvis to open. And we are here to do that, as well as, again, like I had mentioned earlier, there is support for induction. I also love to talk to people at this time and through all of this about their birth plan. But first, let's talk about the induction. I mentioned it before. There's points for contracting the uterus. There's points for dilating the cervix. There's points for descending the pelvic floor. Now, again, I do not recommend that we rush any of this timeline. We are not the ones in control here. I highly recommend that we talk to baby and we support baby and we are in conversation with baby. And unless there is a severe issue with health for the baby and with monitoring, I highly recommend that we let this journey progress as it needs to. And we can help things relax, we can help you support, and there are those points to help them move along in the emotional way that we are holding back and not allowing things to move forward. And we can use those points, and we do those points if we need to. But I recommend doing things as naturally as we can, because the less that we interfere, the smoother the birth will be and the healthier the baby will be. Everything, again, like I mentioned, that goes into mama goes into the baby, and that baby's baby. So whenever we are doing anything that is medically inducing, we are going to have to keep that in mind. And we want to reduce that. If you can do your research on natural birth, I highly recommend that. Obviously, not everything happens that way, and we need to accept that. But I also want to make sure that we mention that natural birth is not something that you decide at labor time. Natural birth is like training for a marathon, and it's a brainwashing that you must do to undo the brainwashing that has been done. Let me repeat that. We have a lifetime of stories and TV shows and movies as a woman that we see people yelling and screaming in pain and they're on their backs. And none of that, when you are doing things naturally, will be just like that. I'm going to be honest with you, I didn't want to be on my back at all during delivery, because it was uncomfortable and it didn't allow for my little one to come out. And if you are not medicated, you are able to walk around, you are able to move your hips. And even if baby is in a less optimal position, i.e. sunny side up, or in a position that's not ideal, baby can flip, baby can move and rotate because of that movement in the hips. And that's what it's meant to do. People don't always realize that. So I want you to do the research on why it's beneficial, why it's helpful, why going through the vaginal canal and the absorption of enzymes to help process dairy. We have a lot of people that are lactose intolerant because they haven't been able to go through the birth canal to absorb the enzymes that we need to digest that. So the more that, and then recovery is a whole nother conversation, and we'll talk about postpartum on a whole nother visit. This is also why in my clinic, I will put my mamas in contact with hypnobirthing or a hypnotherapist or a therapist, any way they want to do it, to really address their fears and their visions of delivery and birth. Because you really want to change that mindset. And you can brainwash yourself in a good way, just like you can get brainwashed in the bad way of hearing things over and over again. You can do the same for the reverse. Myself specifically used that. I had huge fear around delivery, believe it or not, and about pregnancy and about birth and natural birth. And I listened to a session of specifically catered towards me. I discussed my fears and concerns, and then we were able to develop and design an audio that I could listen to and picture and visualize. And I listened to it every day, every night before bed. And I really do firmly believe that's why I could do a natural birth with my second child. And that is why I got to 7 centimeters before I even got dilated, before I even got to the hospital with my first. So I highly recommend that you do your homework, do your research, definitely have questions, and we will discuss all these options also if we do have C-sections, which obviously, thank goodness we have those options. And we will talk about the postpartum and the recovery for natural birth, medicated birth, and postpartum, and lactation and baby support on our next podcast. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.